Hello, Eddie.
Good afternoon, Governor.
Thank you for joining me for today's COVID-19 update. Before we give the remarks and report on our cases, I did want to acknowledge Director A.J. Gary, who is here, our Emergency Management Director for the state, who's done a remarkable job coordinating with our local emergency teams across the state as a result of Hurricane Laura and the tropical storm that came into South Arkansas and hit us pretty hard. But we're very grateful. I think we came through this better than expected, even though there was significant property damage in South Arkansas and other parts of the state. And we had 52,000 without power. It is good news that that's down to 32,000 without power, and I know that will be reduced quickly. And I want to thank all of the electric, the utility teams that are out there to get power restored. And then also the good news, the greatest news, of course, is that right now we have not had any reports of injuries or deaths. And so we're thankful for that and wanted to acknowledge both the teams that have worked hard for this, but also the citizens who responded very carefully and safely to this emergency. The coordinators will be out there doing damage assessments. That will be the next step that we go through as a result of this tropical storm. I did want to welcome Secretary Johnny Key here to wrap up a good week in education. And we have, of course, Dr. Jose Romero, our Secretary of Health. And today I have also Jeff Prale that's here that I will mention our discussion here in just a moment. In terms of the cases, in the last 24 hours we're adding an additional 838 cases. That brings our total cumulative cases to 59,583. In terms of our hospitalizations, once again our hospitalizations are down by 26. That brings our total hospitalizations to 407. And then regretfully our deaths are up 17, and that brings us to 756 Arkansans that have lost their life as a result of COVID-19. Dr. Romero will go through the counties that make up those new cases that we have. I would add that of the 838 new cases, 181 of those are in the correctional facilities. 123 were in the Varner unit. And so that's something that we've detected as a result of our mass testing that we completed earlier. Let's go on to the graphs, and we can see it in that fashion. And here again, if you look at the spike in the last 24 hours, the white is the correctional facilities. And so in terms of the community cases, we're dead even with yesterday, which is not where we want to be, but it does put that in a little bit of perspective. The 7-day rolling average, it speaks for itself. We're flat right now, but we've got work to do. And then this is what I wanted to point out, which I'm frustrated with. I'm sure many people in Arkansas are frustrated with. You see that we made progress for 2 weeks in a row from that peak in terms of our daily average of new cases by the week. And then this last week we ticked up a little bit. Not what I wanted, but that's what we've got, and it reminds us of the work that we have to do still in fighting this virus. And then this shows the hospitalizations. Again, that's such good news because it gives us the cushion. We hope that the new cases will not bring an increase in hospitalizations, but they might. But that gives us the cushion that we've been looking for. And then this is the positivity rate, the percent of COVID-19 positive tests by date of result. Here again is the 10% marker, and you can see that as some of the results come in, because it's date of result, It's backfills some of the earlier days, but even with that backfilling, we're looking at below the 10% mark. So we hope that that's not backfilled more, but we will look at that again next week. And these are the testing by testing site. We've done 6,360 tests, and so again, another good day in testing. And you can see that the commercial labs for 2 days in a row, that's the red, are producing results. They're coming in. And Dr. Romero, good job to the lab, because the lab produced a good number of cases as well, or tests, excuse me. This is one I want to point out as we come to the end of the week, and this is helpful. Dr. Austin Porter is here, who does a great job with this. Dr. Porter, is this on the website as well? This will go up. And so everyone, this will go up on the website, and this goes, it's the 14-day moving average of percent positivity, and it's by county. And so this is what we're looking at from August 12th to August 26th. This is much more instructive than looking back to our cumulative positivity for March. I'm interested now in what's it, the last 7 days, the last 14 days. This gives us good information for where we are right now. And so let's start in Pulaski County, which is the light-colored ones, and I know you can't see all of this, but the light-colored ones are the lower positivity rates. So white and the very light beige color. So Pulaski County, right in the center, is 7.8% positivity. Even though we're having a number of cases here, because it's a populous county, the positivity rate is hanging in there. I like that. Lonoke County, 7.9%. You go down to Sling County, you see it goes up to 11.4%. Garland County, 11.1%. Montgomery County, now that's a small county, probably a small number of cases make this result, but it's 21% positivity. So you see that red area on the bottom left, that is the counties with a higher positivity rate right now. And so we need to be aware of this. We know where we need to work and to focus our attention. You go up to the northeast to Mississippi County. That's a red area in positivity, 14.75%. So this tells us where we're having some success and others that we need to work on, and reminds everyone as to the cases that are in your area. And so with that, I'm going to end with a message as we go into the weekend. And this last week, I think as Secretary Key will point out, we had a good week in education. And I want to thank all the students, the athletes, the teachers, and the staff who've done a remarkable job of getting us through this week in the safest fashion possible. And now it comes to the weekend. And I want to remind everyone that we have to be responsible in the weekend. Because what happens with our behavior on the weekend will impact us next week and the week beyond in terms of our schools, our workplace, our families. And so we can't say, well, let's just have a party this weekend, or let's have a good backyard barbecue and invite 30 people over. We have to follow the same social distancing guidelines on the weekend, and that's important for us. And then finally, I had a great meeting with the deaf community today, some members of the deaf community. And Jeff Prale is here, who was an advocate for them, and told me the story of how difficult it is for the deaf community when they are utilizing sign language, but they also utilize reading lips as part of their communication capability. Well, with the mask that I'm wearing, that makes it impossible for them to read my lips. And so the Department of Corrections, with the request of our Department of Education, asked our correctional facilities and our inmates there to produce masks that have the clear plastic on part of it, which would cover your lips, so they can read your lips if you have a mask. And so this is being supplied to our deaf school so they can read people's lips. But it's also a reminder, though, if a member of the deaf community goes to the doctor's office, if we can have these, be mindful of the deaf community and their needs, and perhaps you can have one of these, and which is obtainable online, so that someone that's communicating with a deaf person can protect themselves and others, but also have the ability with the clear plastic for the deaf community to be able to communicate with you more effectively. So be mindful that they'll be in the grocery stores and they will be out, and if they can't communicate because of the mask, we need to figure out some ways that we can do that and be safe at the same time. With that, Dr. Romero, and then we'll ask Secretary Key to come as well.
Thank you, Governor. So I will add a little bit more detail to the numbers. In addition to a decrease in the number of individuals that are hospitalized, we also have a decrease in the number of individuals requiring ventilation, mechanical ventilation. This has decreased by 4, now at 95 individuals on mechanical ventilation. As the Governor mentioned, we had 17 deaths in the last 24 hours that were reported to us, bringing the total to 756. Of these deaths, 3 of them are delayed reporting. They occurred prior to this month. 3 occurred in Jefferson County, but were not clustered to a single site. There were 4 nursing home deaths, but not clustered to an individual nursing home, and no deaths from correctional facilities. Our active cases at this time are 5,496, and this is comprised by 225 from nursing homes, 668 from correctional facilities, and 4,603 from from community cases. Our testing numbers were quite robust. As the Governor mentioned, we had the Health Department contribute approximately 1/3 of those tests to the total number. For the counties, we have 11 counties that are greater than 20 cases in the county, and in decreasing order of frequency. They are Pulaski County at 65, Benton 49, Washington 41, Pope 39, Faulkner 29, 2 counties tied at 27. They are Jefferson and Sebastian, followed by Craighead at 25, Mississippi and Garland 21, and Independence at 20. I want to clarify again the issue of testing and the need for isolation until you have the result of the test. It is important for anyone undergoing a test, be it antigen or be it a PCR test, that until they receive the result of that test, they maintain quarantine. The health department will contact them and will notify them if they can exit that quarantine. That's very important because that individual could be potentially infectious during that period of time. So again, I want to stress the importance of, if you get the test, maintain quarantine, isolation until you are contacted by the health department with that result. Lastly, I want to address some comments to our university and college students. We know that the weekend frees you up from studies, and you have the opportunity to engage in festivities both on campus and off campus. It's important that you maintain appropriate social distancing, that you use your masks. We are beginning to see outbreaks in some campuses. We are increasing our testing and having specific testing events at several campuses coming up in the next week. If we do not bring this under control, it can spread from the campus environment into the community environment. So it's very important that you maintain the basic tenets that we've always talked about, which are masking, social distancing or physical distancing, and use of hand sanitizer. And with that, I'll end and turn it over to Secretary Keene.
Thank you, Dr. Romero. So today's Friday, and it ends a successful first week of the 2020-21 school year. If you'll recall, earlier in the week, we discussed some schools that had to make some modifications because of situations dealing with COVID-19. I'm happy to say that as of today, there have been no additional schools that have had to make modifications. They are continuing to look at their plans as they've implemented them this week to look to see what adjustments might need to be made. We're working very closely with them in that process. But I just want to say this great job to all of the superintendents, principals, educators, support staff, students, and parents across the state. Because despite COVID-19, despite the very bad weather that we had come through, we can count this week as being a successful week for K-12 education. Also, thank you, Governor, for displaying the mask that is being used in our School for the Deaf. This is a win for government transformation. When we at the Department of Education were notified of this need, we were provided with a pattern, and Secretary Solomon Graves and his team took that, did some work, and found a way to make this available for our teachers, staff, and students at Arkansas School for the Deaf. And I think I would like to commend them in that work and thank the partnership of Dr. Dickinson and her team at the School for the Deaf. And just to reiterate what Dr. Romero said, some of the cases that we've had this week of close contacts are situations that could have been avoided. So parents, if your student is having symptoms or if you have taken your student to be tested, please follow those quarantine guidelines until you have received your test results. In some of the situations, we've had students that have come on campus that were pending test results. This does create an untenable situation, so please be mindful of these situations and follow the health department guidelines. We will continue to work with districts on their data and observe what's going on as they go into the second week of school, and we look forward to having a very positive report next week as well.
Thank you, Johnny. With that, we'll take any questions.
So with the numbers continuing to go up in terms of cases today, any idea what's behind that? Like where the gap is that are people just not following the guidelines or on the weekends, or what's going on?
Well, I wish I could look into the crystal ball and give a clear answer to that, and I'm going to ask Dr. Romero to come and make a comment on that as well. But whenever we see the cases at the level that we see the last 24 hours, that's the first question we ask. Where's it coming from? What more can we do? What should we do? What's the connection here? And invariably, you know, we're getting, as you can see from the map, that there are really cases that are spread fairly evenly across Arkansas to a certain extent. I mean, you've got some variations there, but it's broad-based. It's not in one specific geographic area or one congregate setting. And so that means that anywhere you go in the state of Arkansas, you could expose yourself if you're not careful and you don't protect yourself. And so we look at, should we change any action? And I think we're on the right path, but it's just a constant reminder for everybody to follow the guidelines. That's the only way we can bring this under control. And so we'll continue to look at this. I don't see this, I see it more as flat, but, you know, it's something that we've got to watch very carefully. Dr. Romero?
So as was said by the governor, we have not found any focality, and that is one of the things we always look at when we see this bump. As mentioned, 181 of those cases came from correctional facilities. So that is an explanation for part of that, but there still is this community level that hasn't fallen off. I have to say that I flew to the CDC this week, and it was obvious that even in the airport, even with signs that mentioned the governor's mandate, individuals were not wearing their mask or were wearing their masks inappropriately. And I think that is very important, that we have to take this personal responsibility of using the mask at any time we're in public. When I can stand in line and have 2 or 3 people behind me not using the mask, while others are still using it, that shows that we still haven't, that our message hasn't permeated throughout the community yet.
Any other questions?
Yes, Governor, good afternoon. It's Neil Gladner in Hot Springs. Really, this question is for Dr. Romero. And with regards to the guidance about waiting for test results, is that a change in guidance that I missed? Because I think it was last week he said even if you get a negative, you need to be in quarantine for 14 days. So could you kind of clean that up a little bit for us?
No, Neil, you are correct. If I inartfully explained myself, let me go back and do it again. So what I'm referring to is that period of time from when you have the result, the test performed and the result given to you, that period of time you must maintain isolation. You will continue to have isolation forward, right, even if you have a negative test. So I was only referring to that period from the test to the time of result, where we're seeing people going out into the community or students going to the class. But what you pointed out is correct. Even if you have a negative test, you're still going to be in isolation. So thank you for allowing me to clarify that.
Hey, Governor, it's Chelsea Helms with KNWA Fox 24 in Fayetteville. Attorney General Leslie Rutledge posted several photos of herself last night on Twitter at the RNC. She was, of course, pictured alongside others who represent Arkansas. In those photos, it's very clear there's no social distancing or masks being worn. So what message does this send to Arkansans when state leaders aren't following guidelines that they're encouraging?
I don't know all the circumstances of that event. I know that when I went to the White House, I had to have a test done. And so hopefully those type of precautions were taken. It is important to set the right example. It's important to wear a mask, and that's what Dr. Romero is certainly advocating. We need to continue to do that and lead in that, because that's the tool we have. If we don't have that, then all of a sudden we're having to put restrictions on economic activity, on schools, and it has all kinds of consequences. So that is the right message, that we need to continue to be disciplined, self-discipline, self-restraint in terms of wearing a mask and protecting ourselves. Next question.
Governor Mike McNeil, MagnoliaReporter.com. Was Attorney General Rutledge setting the right example or not?
I have been with Attorney General Rutledge numerous times, and she always is wearing a mask. She's doing exactly what she should do. Has been my experience with that, and so we need to continue to do that.
Well, Governor, bouncing on was that if you get tested, you need to be quarantined for 14 days, and you just implied that because at the RNC they may have been tested, that it's okay. So what is the clear message here? Do we get tested, and if we test negative, we are okay to go out in public, like Attorney General Leslie Rutledge?
So I also do not know the specific circumstances around the testing for the event, if there was any. If our recommendations for isolation are for individuals that suspect they have been exposed to or have been exposed to or do have symptoms that are suggestive of COVID and are tested, they are suspected to be infected, okay? And they should be isolated for the appropriate length of time, 14 days. Now, I don't know what the logic is around the circumstances that were tested in Washington, but if they were testing those individuals, they had no symptoms, no exposure to anyone, had no risk factor for acquiring COVID, and it was part of a screening process, then perhaps, in that case, it is acceptable not to go into quarantine. Does it make, if I answer that question for you?
Yes, sir. Thank you.
Next question.
Governor, this is Andrew.
Governor, it's Brett Ray.
Wanted to ask Dr. I had a couple questions. First of all, wanted to see if Dr. Romero could elaborate on the comment he made about some outbreaks that they're starting to see at college campuses. If you had more detail about where they're seeing that and kind of the size of those outbreaks. And the second question I had was with the numbers that we're seeing at Varner, given the testing that was done of inmates, how many tests are still pending at this point, and I guess how much more of an increase in prisoner cases are you expecting to see?
It's my understanding that the testing is all complete and that the Varner unit actually had these tests done earlier in the week, and so they're a little bit of late reporting and getting into the system is the reason they're being reported today. And so I don't expect that increase in the coming days because we've completed that testing and they should all be reported now.
So regarding the universities and colleges where we're seeing increased number of cases, University of Arkansas at Fayetteville had some testing performed. Approximately 75 cases, 75 individuals were tested. 1/3 of them turned out to be positive, and it's that university that we're going to be having a testing event on 2 days next week, Tuesdays and Thursdays. Prior to that, we had already identified University of the Ozarks as having increased number of cases, and we will be having a testing event next Tuesday at that institution. Again, these point out the fact that these young adults are living in close quarters and that there's always the chance for it to spread in those close quarters if we don't adhere to the 3 tenets. Again, I'll say it, the mask, physical distancing, and washing of our hands. Thank you.
Governor, it's Brett Raines. This is my turn, I hope. Can you explain how are we defining an outbreak at our universities? The second question is, if students are asked to quarantine, does that apply to siblings and parents? One would assume it would.
I could only hear part of that. Could you speak a little more clearly, closer to the microphone maybe?
Sure. How are we defining an outbreak at our universities? And second question, if a student is asked to quarantine, does that also apply to siblings, other siblings, and parents?
Okay, I'm going to let Dr. Romero take that.
So specific criteria I can't give you right now, but we're seeing definite increases of numbers, more than 5 and 7 cases. As I said before, 2/3 of the cases that were tested at Fayetteville were positive, and that is an alarming amount. We're not referring to 1 or 2 cases, we're referring to significant numbers of cases. So with regard to students that test positive, do they need to quarantine their relatives? Yes, again, they would be exposed. That relative would have been exposed to that child, that relative. We recommend waiting until the contact investigator talks to the family, analyzes what the exposure has been, and until that is done, they should probably quarantine it. They should quarantine, and then the contact investigator will give further recommendations.
Any other questions?
Governor, Chad Muir with KNWA News. Regarding the school report released yesterday, an inconsistency I wanted to ask about. Your report going back to June 15th has U of A at 22 cumulative cases, but then the university has reported about 45 cases just since August 10th. So what could be some of the reasons behind the differences in the reports we're seeing?
Let's see, Dr. Porter, do you have an answer to that? Come on up, Dr. Porter. Dr. Porter is the one that keeps this data in tow over the Department of Health.
Thank you, Governor. So some of that may be attributed to some of the delay that we're seeing being reported to the schools, to our reporting system. And sometimes, it may take a few days for that information to get into our reporting system. Now, one thing that we have to speak on is the importance of the case investigators getting that information and doing a thorough job of the contact tracing so that we can know which school or university those cases are being attributed to.
Any other questions? Yes, right here at the table.
I was wondering if Secretary Key could elaborate on students going to school after they get tested. Has that resulted in other people at the school having to get quarantined, or kind of what was the situation there?
Yes, we are aware of a couple of cases, maybe 3, where a student had either came to school with symptoms or they came to school after having had a test and pending results, and then when those results came back, then there were other students that had to be quarantined because of that. And that's why I mentioned that those are avoidable situations. If you're waiting for test results, please follow the Department of Health guidelines, establish that quarantine time, and do not go to school. Whether if you're an adult or a student or a parent of a student, please stay home.
All right. With that, I hope everybody has a very good and safe weekend, and we'll see you on Monday. Thank you.